Hello, my name is Dr. John Char. I'm a holistic practitioner, and I'm going to show you the comprehensive emogenesis technique, CET 1+9. C is comprehensive, emogenesis is E, which is emo means emotions, and genesis is the foundation of, and technique. The 1+9 is, there's a master point here in the Chinese, call it the universal point, right in here, where the tip of the ear goes and meets the other side of the ear, and the line that bisects it in the center is governing vessel 20. That's what would receive the energy from above. And 9 is 9 different master Chinese acupuncture point. So this is what we call the patient's guide. And every one of you who is practicing that or learning this should have this patient's guide. So I will explain to you how this works. The first section of the patient's guide, right here, tells you some of the background of what CET 1+9 does. Then also you will have here what we call the prime affirmation. And this affirmation is used when you have a dialogue with the brain, finding out what core issues that needs to be addressed. And we'll go into that further. Then, as you turn the page, you will have in that the PIS. PIS means pain intensity scale here. And the pain intensity scale is 1 to 10. 10 being the most severe pain that you ever can have. That means that, say for instance, you say, everybody you ask and it's okay, what is the intensity of the pain on a scale of 1 to 10? They might say, I got a 10. And that's very common because it's so intense for them. And 10 means you're on the bed, you can't get up, you've got a needle in your arm for an IV drip or anything, and you're getting into a point where you're very, very ill, very severely, you can't get out of bed. So most people who have severe pain, and it comes and goes throughout the day, usually it's within the range of 5 to 7, means that they have it every day, several times a day, intensity. It's going to be up to 7 or 8. Your goal is to get down to 0. No pain. Absolutely none. And so what this technique helps you do is neutralize the emotional, mental, and physical stresses you have in the body that creates the intensity of pain or discomfort in the body. And when you are done to 0, you will be able to talk about your core issues that bothered you, no matter how long ago it was. It could be 10, 15, 20 years ago. And we will teach you techniques on how you use your subconscious right brain to be able to go back in time and space and recapture that incident of discomfort or of trauma you had in your life and neutralize it. So then when you go back and recapture that image again, you will not have any kinds of feeling or emotions addressed to that. You also will be able to not be able to tear. And we're going to go through 3 different techniques. One is called the tearless trauma technique, where no verbal dissertation is given. The second is with an affirmation, where you will be reciting like a prayer. And the third one could be, that's the one that we use a lot for pain removal. I'll show you the different techniques. On this side of the page, you're going to see here is you're going to have look like two medallions. One medallion will look like this and has a cross. In the back, you have numbers. The numbers are formulas. The front is a symbol. And that is neutral. It has no relationship to any religion. So this is not religion here. We're not talking about religion. We're talking about energy medicine here. And then that's the yin, that's the cross. Then you will also have what we call it's called bioresonators T, which is triangle. You see the triangle here. That's the yang. And the other one with the cross is called the yin. And you'll have these numbers, which is the power generator that you have. We'll go more into that later on as to what these medallions called bioresonators do. Bioresonators, T is the triangle. Bioresonator C is the cross. One is yin, one is yang. And then it will be explained very briefly here what is yin, what is yang. On this page here, you will see a graphic of the technique, very stickler on form. The form, if you have it correctly, where your elbow, which is the key, your forearm, wrist, and fingers are in alignment, you will tap those acupuncture master points every time, consistently. If you don't, then you might miss the point. That's very important that you tap the points, and I'm going to explain that to you later as we do it. On the top, you're going to see some titles. These are reference points. Reference points in terms of location of the points. You might, in a sense, not seem to be logical where you would call a certain point a different reference point or location. But we found that if I give you a reference point and location, you'll be able to remember those points versus if I gave you a number series of 1, 2, 3 and you can't remember. So we're trying to have you do by memory, by reference, rather than the nomenclature of the actual number of the technique. Then on the bottom here, when you see, it will give you more in detail what this positionings are. How do you place your hands if you forgot to look to remember it on the video. And actually 9 points here and one universal point. That's called 1 plus 9, representing the relationships of other acupuncture points in the body. So we'll start off with the tearless trauma technique. We are emphasizing the CET Prime 1 plus 9, the 9 steps emphasizing good form. And it's important to have good form because every time you tap a point, you're going to hit it. And here is the master point, 0. Master point, 0 is on the top of the head. Form a cup with your palm, fingers closed. The heel of your palm is over your hairline. The tip of your fingers are pointing to the back of the head. Your elbow is below your face in a vertical position. Tap the top of your head whilst reciting the CET Prime affirmation. Point 1, the brain point, inner eyebrow and bridge of the nose. Use your index finger tapping your inner eyebrow and the middle finger tapping between your eyebrows and above the bridge of your nose while reciting the CET Prime affirmation. Keep your right arm horizontal and your index and middle fingers straight. The slapping point is the side of the upper eyebrow and the side of your eye. That's number point 2. Use your fingers on the palm side. Slap the outer edge of your eyebrow and the side of your eye where you're reciting the CET Prime affirmation. Keep your right arm vertical and your right elbow pointing down. The eye point is a notch under the middle of the eye. That's number 3. Tap the notch located directly under the right eye with your index and middle fingers. Your fingers should be straight and your right arm and elbow pointing downwards while reciting the CET Prime affirmation. The T point is number 4. It's located between the nose and the upper lip. Tap between your nose and your upper lip, feeling the teeth with your middle and index fingers. Your fingers should be straight and your right arm and elbow pointing downwards while reciting the CET Prime affirmation. The chin point is number 5, between the lower lip and the tip of your chin. Tap between your lower lip and the tip of your chin with your middle and index finger. The fingers should be straight and your right arm and elbow pointing downwards while reciting the CET Prime affirmation. Point 6. Collarbone point is left of where the sternum meets the left collarbone. You tap with the flat of your right fist slightly left where the sternum meets the left collarbone while reciting the CET Prime affirmation. This is on the left side. Remember, with your fist tapping the collarbone. The next point is the armpit point. The armpit point is slightly below the left armpit. Slap with your right palm slightly below your left armpit while reciting the CET Prime affirmation. Point number 8A is the nipple point on the left side. The nipple point under your left nipple. Slap under your left nipple with your right palm fingers while reciting the CET Prime affirmation. Get to the next point is shoulder point 8B. The shoulder point in the left shoulder crease. Poke with your right fingers the crease in your left shoulder while reciting the CET Prime affirmation. The last 2 points are the left wrist point 9A. The wrist point is located 3-finger width towards the elbow, starting from the left wrist on the thumb side. With the right wrist facing down, tap the left wrist point while reciting the CET Prime affirmation. The right wrist point 9B is located 3-finger width towards the elbow, starting from the right wrist on the thumb side. With the left wrist facing down, tap to the right wrist point while reciting the CET Prime affirmation. Here's the master acupuncture points, which I showed you. And the 0 point is above on the top of the head, is governed vessel 20. And it has multiple points right here, as you can see it on the top of the head. That is why form is very important, because you want to tap all those points when you're tapping for 0 point or the master point. We're going to point out number 1, the limbic point and the brainstem point. Number 2 point is the slapping point and is located above the eye and eyebrow. It's a triple walnut 21 and gallbladder point. Point number 3 is the stomach point, the small intestines, and large intestines point. There are 3 points. When you tap on the main point, the stomach point 4, you will also connect with the small intestines and large intestine point. That is called the digestive point. Point number 4 is the teeth point. It is located between the nose and the upper lip. And that's called the upper brain. Point 5 is between the lip and the chin. And that is called the lower brain point. Point 6 is the kidney 27, which is the fear point. And that is the nucleus of all emotional strife, fear. And it's on the left side underneath the collarbone. Point 7 is under the armpit, and it's the spleen pancreas point and the heart point. Point 8 has 2 points. It's below the left nipple, and the other one is on the lung point. It's the shoulder crease of the left shoulder. Point 9 has 2 points on the left and right side. It is 3 finger breadths above the left thumb, and that is the circulation 7 point. Then you go to the right side, and then you repeat the same thing, circulation 7, 3 finger breadths above the wrist. I'm showing the acupuncture tapping points and their location point, the Bose acupuncture point, the description, the affirmation, emotions, breath, color, and eye movements. These acupuncture points are for position number 1, 2, side of the eye, 3, under the eye, and then we're going to show you points 4 to 8. Again, we're going to show you the location of the point, the Bose point, the description, the affirmation, the emotions, the breath, the color, and eye movements of points 4 to 8. This is the last point, point 9, has 2 points. It's pericardium 7, and is on the wrist, 3 finger breadths above the wrist of the thumb side. And the master point is for circulation. I'm asking you for comments to give me, and any kind of criticism, or if you like it or don't like it, put it in your comments. And then you can Twitter me, or you can put it into a YouTube comments, or you can even put it into Facebook. I encourage that, we could get better with the comments.